Hello, everyone, and welcome to Dr. Emmett Emerry Sr. You Better Stand Your Watch Leadership Podcast. First of all, I'd like to give honor to God. Of course, you know my rituals. Without him, nothing happens. Nothing's possible. I'd like to say hello to my wife, Yasemi. She had a big week a couple weeks ago with promotion and everything. So hello to my kids, and a special hello to my son, my only son. I said senior. I mean, he's a junior. And by the way, it's also Emmet the third. Only a few people have managed to do that. Happy birthday, son. His birthday is Friday. I won't be able to spend time with him on Friday because I'm flying out to spend time with my little brother because he having a retirement ceremony. I made a diplomat. I was diplomatic this time. I said little brother. But I'm from the Midwest. I could have said baby brother. Well, I'm going to keep it a little civilized. I'm like a little country right now. So today I have a guest. Today's guest is Mr. Robert Watts. The uniqueness from this guest for today is that I'm talking to him while he's in Chicago. That's right. He's in Chicago. I'm in Florida. And the topic is going to be an interesting topic. Whenever of lately you hear Chicago and you see African Americans, you automatically relate that to violence and crime. And my guest is African American as well as I am. But his job in Chicago has saved a lot of lives. And I just want my audience to understand that the city that I was born and raised in is only viewed in one matter through media, but there's different avenues, different matters. And this individual has been in his profession for years. He'll let you know how long he's been, what he's doing, and all that good stuff. Right now, I'd like to introduce my guest, Mr. Robert Watts.
Good afternoon. Nice to be here. Glad to be here. Do you want me to share a little bit about myself?
Of course. I know I love that shirt you got on, my brother.
Oh, yeah. It's Chicago. I'm representing Chicago Bulls. Hopefully we'll do better this year.
Yes.
But I was born and raised on the west side of Chicago. And, getting out for me was going to college, which was my way out. And I used basketball as that avenue to get out. So I received basketball scholarship to college, and I finished up, got a bachelor's in criminal justice. And then I pursued my master's in social work from the University of Illinois at Chicago. At the time, Jane Addams was one of the top 3 programs in the country. Berkeley, California social work program was number 1. University of Chicago was number 2. And UIC was number 3. So it was an incredible experience. It took me 3 years to do it part-time. At the same time, I'm working as a child welfare specialist for the Department of Children and Family Services, which is the biggest social work department with children and families in the state of Illinois.
Wow.
They service all children that are abused and neglected. And I did that for 5 years. And then after that, I moved on to CRSA, called its acronym is Community and Residential Services Authority. And that really opened my eyes. It was a statewide agency, and we're in ISBE, Illinois State Board of Education. We're in their budget. So we're a government agency that was created by the legislators in Springfield. We was created to help kids that were falling through the cracks of the Illinois state service system.
When was this?
And that's why we were created.
So when was this role created? What year? How long has it been in existence?
1985, we were created in the General Assembly. We was created because kids were falling between the cracks of the system.
Okay.
And people were throwing those kids away. Kids that go to the detention center, kids that have mental illnesses, kids that are fighting in school, they'll throw them away. So we were there to kind of help those kids along and give them some hope and some treatment and some guidance. And we did it through the families. So we not only just work with the kids, we work with the entire family.
Wow, that sounds like a big task.
Yeah, but I was up to the task because of my experience with UIC. They trained me well. So it wasn't nothing that I couldn't accomplish in the social work field.
So what was the age group and what was your budget?
Our age group was 0 to 21. Till they turned 21, then we referred them to the adult system. But our budget, 500,000, and then we got little increases. When I left, I think we were at 580,000, something like that. But it was only eight of us running the whole agency. We were very small, but we were very powerful.
So was that agency for the entire state of Illinois, just the city of Chicago?
The entire state of Illinois.
With 80 individuals?
And I worked with, yes. And
Wow.
we had I was the regional coordinator in Cook County, which covers Chicago. We got a regional coordinator in down in Effingham, Southern Illinois. We have a regional coordinator in Champaign, which is Central Illinois. And we have a regional coordinator in the Northern region. So that's how we cover the state by regions. And then we cover different counties. I got the biggest county. I had the biggest county in the state. So that's all I needed was Cook. But they were working with other counties downstate because they were small. But we were essentially doing the same thing.
Same thing.
Same thing, just different parts of the state.
I hear the passion in your voice as you talk about it. But it's just interesting, your background, because you state that you have a bachelor's in criminal justice, but yet you didn't go into the criminal law field. You went into the social worker field. What prompted you or encouraged you to do that left turn?
Well, growing up, as you know, we experienced mental illness in our family, and I did work in the group home after I got my bachelor's in criminal justice. I worked at the group home for a couple of years before going to DCFS. And I saw those kids in detention that really needed treatment more than being locked in a cell.
What is DCFS?
The Department of Children and Family Services.
Okay.
And so that what made the turn. When I saw those kids in detention, I'm like, these kids need more than just punitive. They need treatment.
Yes.
Mental health treatment. And so that kind of made me turn a little bit towards social work. I said, I can help these kids better, try to prevent them from going to detention or going to jail. And I can't help them once they're already incarcerated. It's going to be difficult.
That's true.
For me to reach them.
Now, my wife still think I'm a little bit crazy. You said growing up. Now, I also know that you have, you're part of brotherhood. You're part of fraternity.
Yes.
And
Yes.
how much of that experience within that fraternity, because fraternity in college is different fraternity outside of college. College, fraternity, you're getting together, the brothers, and enjoying college and things of that nature. And then when you leave college, it's more of community service. So how much of that, your fraternity background contribute to you going to the social worker field?
Oh, I think greatly. I mean, because we did, like you said, we did community service. So we worked in shelters as part of a pledge process. We worked in shelters. We worked in, different kids in different communities. And the Sigmas, they gave me a direction to where I can use the tools that I had. And I became vice president of the chapter. So we had to create a culture. Once, everybody left, it was just me and the president, and we had some few guys, and we made some good brothers, and we kept it going. We kept, because we have a rate where all our brothers has degrees. Every last Sigma in my era that came through, we all have college degrees. And that's what that really helped me. And we helped each other.
Yes.
To graduate. We wasn't leaving no brother behind.
It's uniqueness in you, and I say it, and so far I've said it several times, uniqueness, is that through your due diligence with your fraternity, your brotherhood, you have a set of twins, sons.
Yes.
And one of your sons is also in the fraternity that you're in. How does that, as a father, make you feel?
first of all, make me feel like I did something right, you know. But the thing about it, he never expressed to me that he wanted to be in a fraternity. He never expressed to me that he wanted to be Phi Beta Sigma. So I never knew. He kept it from me. And then I get a call, and it's like one of my frat brothers was like, "Do you have a son at Illinois State University?" I'm like, "Yeah." It's like, "He's online." I said, "What? He's online for what?" He said, "Sigma." I said, "My fraternity?" He said, "Yes." So I was very shocked, but I was very honored at the same time that he would look up to me in that way and follow in my footsteps. So that was very honoring, and I appreciate it.
I did a little
The
bit.
other one could have, but he went Kappa Alpha Psi.
But he still followed your footstep and went to brotherhood. So
right.
in college, they make a distinction between the fraternity and sorority. But once you're done with college, it's all about sisterhood and brotherhood and community service. So it's one helping the other. I view it as no different than an athlete who's on an athletic team. When they're done professionally with that team or what they're done with their team, they still take communication. Or military personnel who joined the military together, those same things. So it doesn't matter what fraternity or what sorority you are labeling outside. It's what about you doing from what you feel in the inside to support the community.
Right. I agree.
And I respect you for that.
It has to come from
Exactly.
Yeah, it has to come from the heart.
And I respect you for that. And I said that because I think that has made a great impact on what you have done over the years with these other kids. And let my audience know how many years of service you've been involved with that and where you are on Saturday.
Well, I've been involved in social work for 30 years.
Wow.
And I retired as of August 1st was my last day.
Wow.
Retirement date. But even, I've worked with kids. Actually, when I was at UIC in the master's program, me and one of my buddies of mine, you met William Harris before, he was in the PhD program, and they was my frat brothers. We created First Team Consultant.
Wow.
Which we had kids coming to school on Saturday mornings. And we were teaching them life skills. We were teaching them reading. And I was teaching them different skills in basketball.
Wait. Are you telling me that this was going on in Chicago?
Yes.
Wow. Nobody outside Chicago knows this.
It was going on in the heart of the West Side.
Wow. What was the crime rate at that time you guys started doing this?
Oh, it was very high. It was very high at that time. Yeah, it was kind of, things are like it is now. Things are getting worse than it was back then.
Yes.
Yes. It was a lot of gangs back then and a lot of territories and fighting over territory. Now it's just, it's not even gang related no more. Violence. It's just violence. Yeah. Because people don't have the resources.
That's what it is. Okay, employment of social workers projected to grow 15% by 2026, according to the Bureau of Labor Statistics. Or I could do like you state initials, BLS, which is faster than the average for all occupants. Illinois, Chicago is among the top states for this profession. Do you agree or disagree with this projection?
I agree. And in large part, I would say due to COVID-19. I think that changed the world as we knew it. And I think it changed people as we knew them. Some people can't be in isolation. Some people need to be out. They need to be socialized. And when you take that away from young people, then that creates anxiety for them. Anxiety is a mental illness.
Yes.
And I think that a lot of people got anxiety from COVID. Kids didn't want to go back to school. They were at home every day working on a computer. Parents became teachers, even if they didn't want to be teachers,
right?
Because the schools were closed. So I think, yes, and I think it's going to be a need for more social workers.
Wow.
As time go on.
There are several social workers professions in Chicago. I did a little bit of research. I looked this up. aging, adulthood, and gerontology, children, youth, and family, global social work practice for immigration and refugees, health and well-being, military, school social work. Which of the social areas do you work, and why did you choose that particular area to specialize in?
Well, one of the main reasons when I was in the master's program at UIC, we had a choice. A lot of people went to school social work because they get out for 3 months, you know? It's like, hey, when school is out, they're out, you know? So I get it. But one of the main reasons I chose children and families was because the Department of Children and Family Services was paying for my master's degree. Mm-hmm. So I had to go in that field because they were paying for it. Mm-hmm. I didn't really have to, but it made it a lot easier for me to get my master's paid for, and it helped me to move on to the Community and Residential Services Authority. And I wind up doing school social work anyway, because I attend IEP meetings. So I kind of do a little bit more than what the school social work does, because I know about the system more than they do.
I'm a very spiritual man, as you are yourself. Could it have been that was your calling?
It could have been. I mean, I enjoy helping people. I love to see people happy, you know. If I can help someone, I'll help them, you know. So I guess it's rewarding for me to help a family when you've made a difference in that family. That to me, that's rewarding, you know. So, you know, you don't get into social work for the money because it's not a high paying job.
I heard.
So you get into it because of the passion to help people that are less fortunate than you.
The protection of children has undergone significant change over the past 30 years and is now internationally recognized as one of the most complex and challenging areas of policy and practice in human services. Working in a statutory setting to protect children means practitioners are often working with the most vulnerable families who may be affected by substance abuse, mental illness, violence, homelessness, and or poverty. What sort of changes have you seen over your career? What sort of impact, positive and negative, have they had on society as a whole and your community of social workers?
Well, I, on the negative side, I've seen less and less resources.
Really?
Yes. And when I say resources, I mean those intensive services. Intensive, I mean in-home therapy, respite, residential treatment. Those resources had been drying up a lot due to COVID as well. COVID had an impact on everything. So now they're trying to build resources back up. There's not a lot of places in Chicago for these kids to go that needs that high level of treatment.
Wow.
That means they need to be out of the home and in a facility. And there's not a lot of facilities. And then some facilities can choose which kids they take.
Really?
They don't want the violent kids. Yes. You can't make a facility take a kid.
Wow.
You can't force the hospital to put a kid in inpatient treatment.
I thought all that was connected with the city.
No, wow. That's different. The state runs those facilities, not the city.
Wow.
Yeah, those are state operated facilities.
So it sounds like to me, correct me if I'm wrong, that during that process with limited resources available for these kids, and you do your job effectively, were they misidentifying these kids and locking them up, thinking that versus the mental illness that they had?
Yes. A prime example, what happened in that McDonald with that kid, last name McDonald. He was a mental illness kid, and the police shot this kid because he was coming at him, but he was coming at him because he was mentally ill. He was asking them for help. And police thought he was charging at them and killed them. But he just wanted mental health services. A lot of these kids want help. They just don't know where to go to get it.
Wow.
And the parents don't know, you know, and it becomes a vicious cycle. Because some of the parents are mentally ill as well.
That's true. So how do these kids integrate with the average normal child in these public schools or Catholic schools or other schools that they go to?
Well, that's when the IEP comes into effect. It's called the Individual Education Plan. And a kid with a disability should have that plan, their own individual plan to fit them into the public school and try to make those kids as normal as possible. So you try to do as much inclusion with their peers. You don't isolate them. You don't put them in different. You try to keep them in the same similar classroom, but you just put an aid in there and put some supports in there. Because kids want to be normal. They don't want to be isolated and looked at as different.
But
so you try to keep them as.
But doesn't that put the teacher or the classroom at a disadvantage? Because some teachers are not trained to deal with a mentally ill individual.
That's the problem. That's lack of resources because you don't have a lot of special education teachers. That's the issue. But you can always get an aide in there or someone who specialize with kids with disabilities. Schools can be creative. Principals can be creative. They can have people from the outside come in and pay them and teach the staff how to deal with violent behaviors and how to deal. That's when training comes in. You got to train these teachers to deal with these new set of kids with new set of problems. They have different problems than in the past.
So who diagnosed them?
Because a lot of
who diagnosed these kids?
Oh, they're pediatrician.
So can you
or the psychiatrist.
So had there ever been a mixed up between a gifted child and a mentally ill child?
Depends on the behavior. Yes.
Elaborate.
Yes, because you got some kids that are very, very smart, but they on the spectrum of, well, it used to be called Asperger's, but now they just lumped everything in with autism. Oh. Asperger's is a form of autism, but it's the high functioning kids with IQs off the charts, but they don't have any social skills. They don't know how to talk to other kids. They don't have friends. They isolate themselves, but they're very smart. Those are kids that awfully get overlooked, but that's a mental illness. Even though they get all A's, the school like, well, you get all A's. We don't have a problem with him, but he don't have any friends. He don't have any social skills. He's been picked on. He's been bullied. Those are the type of kids come back and cause violent outbursts and violent behaviors in schools.
How many of these kids have gone on to college?
As far as the kids that I've worked with, not very many. Not very many. I help them. When you say college, my goal is to transition them into a higher level of learning. And that doesn't always equate to a university or a college. It could equate to a trade school. Are they good with their hands?
Right.
College ain't for everybody. Everybody can't maintain themselves.
Right.
So that's my next project too.
How you get a project you retire? How you get a project you retire?
Yeah, that's something I'm gonna be working on in the near future. So I'm just gonna enjoy my retirement to the end of this year. And next year I may, start working on some projects.
Okay. All right. I'm not doing that when I retire. I'm out. Golf courts. 1 in 4 workers are dealing with a child that has a mental health, a behavioral health issue. Now I'm finna utilize your leadership skills, your leadership thinking. I'm going to the workplace. However, for parents finding care for their child, may include many obstacles such as long wait lists or expensive copays. A survey found 55% of working parents said they did not feel like they had enough support from their employer while they tried to help their child. It was more critical and crucial than ever before that employers provide support for both their workforce and their dependents. How do you display your leadership skills to explain effectively to families on how to manage or who to seek help in assisting them on how to cope with a child that has a mental health or behavioral health issue?
Well, yeah, I have explored with parents many different options. Some parents have lost their job due to their kids happen to run up to the schools and, happen to be in hospitals. The one thing I tell parents is your private insurance. Use private insurance as much as you can, and you can still qualify for Medicaid depending on how much you make. And Medicaid can do a supplemental to your private insurance because the copay is very expensive.
Right, right.
So so I've worked with parents as far as with their private insurance and trying to get them Medicaid services through the state, which will offer more support. And maybe, we can get this kid in an after school program or something through the Y so that you don't have to, you can stay at work. Just exploring different options with parents, what we can do. We can utilize different resources, the school, the YMCA, the park district. I just explore many options with parents when it comes to their employment. But of course, there's only so much you can do,
right?
With their employers.
What do you mean by park district? A lot of cities, I got my audience looking at this podcast. Some cities doesn't do things with park district. They might have park forest or forest reserve and things of that nature, but park district in Chicago is different. Explain park district and how you utilize the park district.
Well, I mean, in Chicago, most neighborhoods have a park district. We had a park district, Douglas Park, Humboldt Park. How we utilize the park district is after school programs, and or we have someone, partner up with the school. The park district partner up with the school. Any troubled youth, send them over to the park district. We'll work with them. Parents can't pick the kid up. So, get them on a bus. And it's transportation all over the city. And there's been bus shortages as well. So now you got agencies using Uber to get kids to services, to resources,
but the agency
to the park district. Yes. The park district we can get funding through Medicaid or through the community center, or we figure out a way to find the funding to get the resources we need. First, we identify the resources, then we go after the funding.
For the individual still puzzled on what a park district is, a park district includes a collaborative of daycare, gym facilities, softball fields, football fields, cross-country courses. It's like a recreational center, but it's within the park. And so we call them park districts in Chicago.
But it's really like a community center.
Yes.
We just call them park districts. In the suburb, there are community centers, and you go there and they have different, classes, parenting classes. They have different resources for adults and children.
So you just tapped on something. You said the suburbs. In Chicago, the suburbs.
Right.
So basically, it's a difference between city park district and suburban park district. You care to elaborate on that?
Yes. Well, in the suburb, most of those park districts, it's one community, and everybody goes to that park district because that's the only community center in the town.
Wow.
So everybody in the town goes to that particular center. In Chicago, it's so segregated in different neighborhoods. People go to, it's not always the same people in the same neighborhood to go to the same park district.
Right.
But in the suburb, it's like that because they're not going to let someone from Chicago come all the way out to Addison because they don't live in Addison. They live in Chicago. So it's like you can't, it's based on the address.
Oh, so
and
it's
the
residence
address
space.
in the community. Yep. And that's how the money and the resources is in the affluent neighborhoods.
Okay.
Because they're paying into the park district, they're paying into the schools, and a lot of them own homes in the suburb opposed to in the inner cities.
Good. Montrose Behavioral Health Hospital is a leading provider of inpatient psychiatric care for kids located in the Chicagoland area. Please explain your role, if any, with this facility.
I am aware of the facility, but I do not work directly with inpatient and with hospitals. What we do, though, is we refer families. Most neighborhoods have a mental health center where they just deal with mental health, substance abuse, counseling. Most neighborhoods have one. Every neighborhood should have a mental health.
Okay.
So what I do, instead of going through the inpatient, sending parents or families directly to the hospital, I'll send them to their local mental health center to see if you can get some, before he gets hospitalized, put some services in there through the mental health center, get him a therapist, and get him a psychiatrist so he can get a psychiatric assessment to see what services he does need. First, you got to figure out what is it that he needs.
Exactly.
And once you figure that out, then you try to plug the resources and the funding to surround that kid and that family once you know what services that the child needs.
That's very important.
That's the biggest hurdle.
It's a very important.
Yeah, because a lot of people don't know what the child needs. They're assuming, but they don't really know.
Mm-hmm. Misdiagnosis is one of the biggest problems we have in this United States.
Yes.
Because I remember
putting labels on people.
When my son was 9 or 10, and at the time they diagnosed him as being hyper, and they wanted to give him medication for it. I said, ain't nothing wrong with that boy. I say, just like I was growing up. So I put him in football, youth football.
Yeah.
He practiced. After he done with practicing, when he came home, he wasn't running around. He was tired.
Right.
He took his butt to sleep.
Right.
So he had to get out and do things, but they didn't see that. They misdiagnosed him.
Right. But in the city of Chicago, kids ain't going out to do things because it's too dangerous. It's too violent.
That's true.
So where are they going to take that energy?
That's true.
They're going to take it out in the house and at school. And then they're going to give them medication for that. And you got a lot of single parents, they not putting kids in sports, or the kids playing a video game. Nowadays, sports is not like it used to be for kids. Wow. We need to get more kids in sports and get them off the video games. But Chicago is so violent, kids are staying in the house. Kids are staying in the house.
They forced to stay in and be on video. Yeah. And that's not the way to live. Yeah.
And that creates mental illness with the anxiety and everything. And the hyperness that creates the mental illness.
Wow.
If you could treat the mental illness, but the kids still can't go outside because it's too dangerous.
Wow. So how are you treating it then?
You got to find other ways to keep him busy so he can burn that energy off.
So what happened when you heal the child, but then the parent go crazy?
Oh, well, the parent is, it's difficult. I mean, I refer parents to counseling. Okay. It's counseling for adults or family counseling. To deal with the family as a dynamic. Yeah. Okay. So I just connect the need. If I see a family that needs it, I'm going to refer them for family therapy instead of just individual for the child. Well, the child get the individual and the family get family therapy.
But do you get a lot of resistance through the family as a whole to do family therapy?
Sometimes because the parents don't think nothing wrong with them.
Right.
But as they say, the apple never falls too far from the tree.
Well, Mr. Watts, Robert, thank you for coming on my podcast. I really enjoy talking with you about the social worker field and the mental health. It's a very serious field that a lot of people are not aware of, and it's not being addressed. Being a military veteran, we had a lot of mental health issues within the military, and now they're seeing it with the veterans outside. A lot of people you see on the side of the roads with the signs saying work for food or asking for money, those are war veterans. I mean, they fought and shed their blood for this country. And then mentally they can't function within this country. So they end up going back to the streets. So my heart and I'm still praying that we find a way to support them. And I'm praying we find a way to support the city of Chicago and mental health. And I'm glad you finding ways to still be involved with that, even though you retired.
Yes.
Any last words you want to say to my audience before we leave?
No, just thanks for having me. Thanks for letting me express, myself and good conversation, and wish everyone the best.
You see, I'm not the only intellectual, once again, individual of the family. You see my younger brother out doing things and reaching and accomplishing. And I'm a little bit upset with him. I say this going off the air. I'm upset because he retired, I'm still working. Until we meet again, thank you and goodbye.